what are the risks of any surgery? Infection and bleeding. Those two things, if you cut anything, those are possibilities. The risks of this particular procedure include the following. As we briefly alluded to, an inability to close the arm. So in a certain number or situations you are faced with, this is too tight, I can't close it. You have to make a decision at that point. Is it because too much was taken out, or too much swelling occurred? By the time you cut and you're closing it, but swelling occurred because you're closing around a cylinder, it prevents you from closing. Fortunately, in our particular marking technique, that's fairly unlikely because of all the little things that we keep on doing to check for that, and the surgical technique itself does not allow us to spend time between a resection and closure. We do that in segments and close very quickly. But it's still, despite everything, those are still possible things that can occur. Now, what if we felt that we couldn't close it? What would we do? If I thought that it was just swelling, I would wrap your arm and I'd leave it wrapped till the swelling went away in about a week and then close it.
Okay.
If I felt that it was too much tissue taken out, then I would take some of the skin that we took off and use it as a skin graft to cover that area. So those are the possibilities. We try not to go to that last one very much, but we've never used it actually, but there's a chance that that could happen.
Okay.
Now, there's the arm and any part of our body is full of nerves, sensory nerves and motor nerves. Sensory nerves are nerves that give us sensation. Motor nerves are the nerves that make us function or fire our muscles. The ones that are really at risk in this surgery are the sensory ones.
Makes sense. You're interrupting that.
Right. And I would say it would be unreasonable to tell you that you're not going to have sensory loss somewhere in your arm. And probably somewhere along the arm, you're going to, if you felt, there'll be areas that are probably permanently, there's permanent loss of sensation.
Is it just along the incision, or is it?
Sometimes it could be a distance from the incision, especially in this region up here.
Okay. Now,
my impression is that this area doesn't bother people, because if you ever test it, there's a lot more of it than people complain about it. So it's just an area that's not that obvious. The areas that are a little bit more problematic is as you get out here, because that's the area that you rest your arm on,
right,
and you might not feel it. It hasn't happened a lot, but it's happened at least in one patient in one arm.
Okay.
So there's a possibility that you can get some of that.
Okay.
There is, although the motor nerves are not directly in the wound, if we get too tight a closure, we can potentially compress that nerve. There's a nerve that runs here in the elbow. It's actually a bunch of nerves, but the one that's most likely is right at the bottom of the elbow here. And that can sometimes cause some problems with motor function. It's unlikely that we'll actually have cut that nerve because it's so deep. So if it should happen, what one would do is try to release tension if there's tension on it, and allow that nerve to come back. We would probably refer you to a hand surgeon if that were to happen, but like I say, it's not very likely, but it's a possibility.
Okay.